GAD, second to only OCD, okay, in the number of kind of referral and the questions we have around how do you differentiate. GAD is the worry, right? Is the heavily cognitive component of anxiety. Okay? It's meant to be an enduring pattern of anxiety and worry, so really about expectation of the future. This one, whereas fears kind of ground us in the ready moment right now, GAD pushes us towards the future. Right? The what ifs, the worriers. But people who have GAD don't call themselves worriers, they call themselves planners. Okay? So planning for, there's a feeling that there's something very functional about this. Right? I'm controlling my environment. This is good. The problem isn't me. The problem is you for not planning as much as me. Okay? But the problem is not in the planning. The problem is not in the what ifs. It's when the what ifs take over and exhaust the person. And then the consequences of that exhaustion, right? And that's really the thing that drives people to seek support when they're generalized anxiety. Because in generalized anxiety disorder, they're not trying to avoid an outside situation. What are people trying to avoid with generalized anxiety? Uncertainty, good. And what does that mean for uncertainty, right? So people with autism have a desire often for sameness, for rigidities, right? For those kinds of things. So if they already have that, then developing generalized anxiety on top of that would require not the presence of something that's new, but an intensification of what they're already inclined to do. And those kids who do perseverate more on sameness and have a fixed response are more likely to also be the chronic worriers, the what-ifers, okay? The planners in the group, okay? So this is kind of the model, right, for GAD, right? We ask what ifs, and usually the first what if is very rational. The first what if that people ask makes a lot of sense. It's usually the next one or the one afterwards that's actually linked to the experience of anxiety. So if I was coming in here and the first thing I thought was, what if I don't do a great job? It's possible that I'm not going to do a great job. Makes sense. The answer might be, well, people will probably like some of this and probably won't like other parts. Okay, makes sense, right? But if my answer was to that, what if I don't do a great job, was, well, people won't really like what I'm doing. Okay, now I'm starting to feel a little bit anxious. And I said, well, what does it mean if people don't, right? What if people don't like what you're doing? Well, then I better, what's that? They leave, right, so they leave. All of a sudden my anxiety is a little bit higher. Why? Because what does it mean if they leave? Right? If I really got to find that high anxiety thought, it's got to be something pretty extreme, right? So we don't start there. We don't start with the pretty extreme thought. We might not even be aware of that extreme thought, especially if you lack that cognitive complexity. So all you might be getting is the first one, the what if I don't do well? But really the anxiety is not related to that question. The anxiety is related to one or two down the line that they're not aware of, okay? So answering the question, the reason I say this is answering the question that they're asking is giving them some reassurance, but why isn't it working? Because that's not actually the thing that they're trying to avoid here. Okay? So how can you work with something like that? Visually, actually, is the perfect way. You start, right, with your arrows, with the situation, the question that they have, and their anxiety afterwards. And then you add some spaces, right? It's what we use for any general person with GAD, and it's perfectly designed already for people with autism. You have new boxes, and in those boxes, maybe you have multiple choice answers that they can pick, and then an open-ended statement that they could fill in, and then you put that in there. Right? So you start to become aware, what are those hot thoughts, those really negative ones? So there might be a focus of worry. It's supposed to be generalized. Be careful that GAD is not, it's typically about the future, but careful that it's generalized and not restricted to one area, and not just worry about something they're afraid of getting access to, something their pleasurable activity or their perseveration. GAD is meant to be generalized on purpose. If they're only really concerned about what if I don't get X, or I'm always perseverating on X and that's like sameness, and the only thing I'm concerned about is what if things are changed, okay, then it's something you want to address, but it's not generalized yet. It still might generalize, but just not yet. So are there perseverations associated with physical signs of distress and worry? Are they constantly asking for reassurance across settings or across people? The more generalized their reassurance seeking, the more likely it is, in fact, that they have generalized anxiety. So they might not ever articulate to you their worries, right? This is the big question I get is, how do you know if they'll have generalized anxiety, if they have generalized anxiety, if they can't actually tell you what their worries are, like most people can, right? Or you can't talk to them about their worries. The only real clue that we have towards this is, do they show generalized reassurance seeking? Okay, across contexts that's not linked to any specific stimuli. Right? And has that changed for them over time? And is it not associated with their current developmental level, right? Remember, if it's just a discrepancy between their supports and their expectations, then it's rational reassurance seeking. So it needs to be beyond that. Okay. It also doesn't abate. Unlike panic, GAD doesn't really, disappear and then come back again and then disappear and then for long periods of time and then come back. It's typically quite chronic. There might be excessive worries about novelty and change. They might always have been focused on novelty and change, but now they're quite excessive about this. And there might be lots of worries about sameness, about intolerance to uncertainty. So the question here isn't, are they going to have worries about this? The question here is, does it change in their manifestation over time? Is it more severe, more impairing, even if they've always had it? So a few things to keep in mind, a few tips. One is try to distinguish between overall emotionality and generalized anxiety, okay? If somebody is intensely anxious about many things, but also intensely happy and intensely sad and intensely angry, and they feel their emotions on their surface, we often say, oh, they've got generalized anxiety. And it's true, they do. They've got generalized emotionality. And that's important because that focus on just worry is not going to be what we really want to target in this case. We want to target their ability to regulate their emotions across emotional content, not specific to just worry. So if you have kids who are highly emotional, and you've identified that content, then you don't want to just focus on something like facing your fears. You want to try to round out the content on worry and facing your fears with facing X and facing Y, because our kids are going to struggle often with that generalization bit. We can't assume generalization. There is going to be a subgroup also that manifests with aggression. Just like in the general population of teens where depression often manifests as irritability, when you lack the communicative or assertiveness skills and you've experienced failure in getting your needs met in the past, you're very likely to begin this cry for help with a shift towards aggression. Aggression towards others, aggression towards yourself. Of course, a functional assessment of that, a functional understanding of that behavior is critical. Because if you can identify that it is escape-related behavior versus access to tangibles, that's going to give you more clues as to whether anxiety is part of the picture.